Navigating its way through the twists and turns of a bronchial tube, this tiny tentacle could soon transform how doctors discover and treat lung cancer. Guided by magnets outside the body, the tentacle has both a camera and a laser. Smaller and less invasive than standard equipment, it can travel 37% deeper, allowing clinicians to detect and easily remove tumours. Developed at the Storm Lab at Leeds University, the team has been working with scientists and doctors to drive the project forward and perfect it.
Our goal is to go as deep as possible inside the human body with non-invasive techniques to diagnose and treat disease like cancer. They can get tissue samples that can be sent to a lab for further analysis. And in terms of treatment, they can deliver energy, drop drugs for localized drug therapy.
Magnets play a huge part in the success of the project. Made of silicone with magnetic microparticles, the robots are assigned north and south poles, allowing the team to control each end, bending and moving the tentacles to where they need to be.
We also have sensors inside the robot that tell us how the field is at the position of the robot, and using this feedback we try to have intelligent motion. And so eventually also like autonomous navigation, so that the robot can perform the procedure on its own, with of course always doctor supervision, but not an active participation from the doctor.
Each journey into the body will be tailor-made for the patient. The magnetic tentacles will be pre-programmed, so they'll be able to be guided autonomously to wherever needs to be investigated or treated.
All our tentacles are patient-specific and customized. So what we do is that we perform a CT scan and we extract a pathway that we are going to navigate through with our tentacles. And then we have a special algorithm that extracts those magnetic profiles, as we call them, so that we can magnetize the catheters in a specific way. This is all pre-planned before surgery, so we are pre-programming the design and the magnetic profile of the catheter, and in the same time we're also pre-programming the motion of the robots as well.
At 80 millimetres in length and 2 millimetres in diameter, the robots are small enough to reach where they need to. But with further testing, the tentacles may evolve and become smaller still.
There's plenty of iterations to go through. We always are trying to make things more miniaturized, more smaller. We're trying to functionalize tentacle robots with tools like lasers or grippers in order to give surgeons more options to help patients.
It may be a few years until the magnetic robot tentacles are available in hospitals, but the findings show that the technology could be used for other diagnostic procedures, which could allow clinicians to reach some of the smallest anatomical spaces. Alex Isat, CGTN, Leeds.